Thanks again, everybody, for joining us for the first in our webinar series for National Arthritis Week. And this week we're focusing on everything to do with lifestyle medicine. So thank you all for joining us. And my name is Tara Regan, Communications and Advocacy Manager at Arthritis Ireland. So just to let you all know, as I said, that it is National Arthritis Week. We're celebrating it from the 31st of March to the 6th of April. And the aim of National Arthritis Week is to raise awareness of arthritis and to empower individuals living with the condition to, to empower them with the knowledge and skills to better manage their arthritis and their health outcomes. So as I mentioned, we have 3 webinars this week, and today's is the first in this series. Just to let you all know, these are being recorded. So if you can't stay for the full session, or if you know of somebody who wasn't able to make it, just let them know that they'll be available to watch on our YouTube channel, and you'll also receive a link to it if you registered for the webinar in the next day or so. So just a little bit about Arthritis Ireland itself. It's the national charity and patient organisation for people living with arthritis, and we deliver support, training, education and information. You'll find a huge amount of information on our website in relation to disease-specific topics. We have a lot of information about our self-management programs, which are obviously for people to help them to develop the skills to manage their condition. We have a helpline which is open from Monday to Friday, 10 to 4 p.m. And the number for that is 0818 252 846. And if you have any questions at all, our website will be able to help you in terms of our podcasts, webinars, recordings, and booklets. We have a huge amount of information there as well. So just a little bit about our speakers today, and I'm just so grateful to them for taking the time out of their busy schedules to talk to us. So first up, we'll have Dr. Lisa Mellon, and Lisa is a health psychologist and humanistic psychotherapist, and she lectures on health behaviour change theory at the RCSI and is a certified lifestyle medicine practitioner. Kate McCann is also joining us, Dr. Kate McCann, and Kate is an Irish Medical Council registered doctor with more than 15 years of clinical experience and a certified lifestyle medicine physician and creator of the social media project MDoc Health. And we are also delighted to have Una Martin with us today. And Una is an advanced nurse practitioner who holds a diploma from Positive Health at the RCSI and is undertaking lifestyle medicine accreditation, and has been involved also in the development of a booklet which is available on our website, and it's called Living Your Best Life, a simple guide to living with arthritis. Una is also going to be here for the Q&A today to take any questions that anyone might have specific to arthritis. So thanks again to our speakers for joining us today. We really appreciate you giving up your time. And I'm going to hand over now to Lisa, and I'll let you kick things off, Lisa. Thanks so much.
Great. Thank you, Tara, for that introduction. Can you hear me okay?
Yes, I can hear you fine. Thank you, Lisa.
Okay. So welcome, everyone. And I hope that, well, first off to say Arthritis Ireland has some amazing resources on lifestyle medicine on their website, really comprehensive work. And they also have their podcast, Information Nation, which has an episode on lifestyle medicine. So we direct you to those. I have links at the end. But what we want from this session is this really to be a conversation starter about how you can examine your lifestyle and see where you can make healthier choices, but also to reflect on why behavior change is hard and what you might need to do in your life to restructure things to help you be more successful. So in terms of our outline, in this quick session, we're going to introduce you to what lifestyle medicine is, what the pillars are that underpin a lifestyle medicine approach, talk again about that behavior change piece around incorporating strategies that will help you to make life-lasting changes. And then Dr. McCann is going to give us the information, the guidelines around 3 of the pillars of lifestyle medicine, so diet, exercise, and substance use. And we will talk about the other 3 pillars on another webinar on Thursday. So that's sleep, stress, and social connection. So I hope you can join us for those. And then we have a Q&A at the end. So I think you can put questions into the chat and we hopefully will get to those at the end. So this is quite a wordy definition from the American College of Lifestyle Medicine, but to put it in simple terms, lifestyle medicine is, I suppose, one of the more recently emerging medical specialties which treats chronic diseases in a non-drug, non-surgical approach, focusing on evidence-based lifestyle interventions to both treat and prevent lifestyle-related diseases in a clinical setting. So it really hands back control to the patient in terms of equipping individuals with both the knowledge and the strategies, so the life skills to make effective behavior changes that address the underlying cause of disease. And I think that word there, underlying cause, is really important because historically, or in some senses, the treatment of chronic disease very much manages the signs and symptoms of the disease once they're apparent, so once a diagnosis occurs. And often that's too late in a way to prevent further deterioration. It's a case of locking the stable door after the horse is bolted. It's too late. So a lifestyle medicine approach addresses the underlying causes, so prevention before the disease actually gets hold or occurs, but also in terms of if the disease is present, to reduce the impact of that on a person's health by this lifestyle medicine approach. So focusing on the lifestyle causes. So there is extremely strong clinical evidence over decades to show that about 80% of chronic diseases have a significant lifestyle cause. So what we do and how we live causes us to develop most chronic conditions. So the 6 pillars of lifestyle medicine, so the 6 tenets that we should focus on for better health are, and I'll go in clockwise order here. So the first one is nutrition. So that's a whole food, plant predominant diet. So if it doesn't come from the ground, you probably shouldn't eat it. If you can't pronounce one of the ingredients on the back of a packet, again, you shouldn't eat it. And again, Kate will talk us through more in-depth guidelines around nutrition. The next one is regular physical activity. And I suppose I want to distinguish between physical activity and exercise, because people often hear, okay, well, I need to be exercising, and that's, pounding it out 3 times a week in a gym. That's not the case. Exercise is a subset of physical activity. Physical activity is just movement. So having regular, moderate level movement in your day-to-day life is what we aim for. Restorative sleep is also a pillar. And again, sleep can be a very under-acknowledged cause or risk factor for chronic disease, particularly around inflammation. And again, it doesn't get the spotlight it deserves in terms of its harm. Stress management, which we know can contribute to chronic disease. Avoidance of risky substances. So this will be smoking, vaping, alcohol, drug use. And then the last pillar is positive social connections. And we know that social isolation is an independent risk factor for chronic disease. Again, that probably wasn't given the attention it deserved in recent times, but now is becoming, as the evidence emerges, is becoming more and more addressed when treating chronic disease. And you might say, well, okay, if I do all these things, does it actually work? And again, there's lots of strong clinical evidence to say yes. And to give you an example of this, data from a European population, so about 23,000 adults who had had some kind of a cardiac event or a stroke, were followed up for 8 years. And those who adhered to a good lifestyle, so increased physical activity, didn't smoke, had a good diet, and maintained a healthy weight, had a markedly reduced risk of most of the chronic diseases. As you can see here, they had a 93% lowered risk of type 2 diabetes, 81% lowered risk of heart attack. They have the risk of stroke, and they reduce the risk of cancer by just over a third. So really strong evidence that this approach works. So it sounds like a no-brainer, doesn't it? Why aren't we all doing this all of the time? And why aren't rates of chronic disease plummeting internationally rather than going in the opposite direction, increasing rapidly? And I suppose this is a very complex answer that we would take longer than this webinar, but life is complex, and things get very tricky when we talk about making change. And the important thing to note is having information alone is not enough. We can have all the information in the world, but still find it hard to implement these changes, and that's okay. And again, coming back to evidence, there was another study that incorporated 150,000 people, again, a European population, who'd had, again, a cardiac event or a stroke. And when they were followed up in over 5 years and assessed as to whether they had a healthy diet or were physically active and didn't smoke and kept healthy weight, only 1 in 20 were adherent to this lifestyle. And so that's 1 in 20, even though they'd all had a significant health event. So that just shows the complexity involved in making these changes. So let's jump into why things are so hard when we talk about behavior change. There we go. It's a lot easier to give up things that are good for us than things that are bad for us, isn't it? So what makes this so hard? And we talk about psychological factors and also practical factors. So from a psychological standpoint, we're often overly optimistic in how successful we're going to be about change. You know, we do new year, new me, new week, new me. And it rarely actually plays out that way because, again, life's very complex and things get in the way. And when we talk about lifestyle change, the benefits of changing lifestyle aren't apparent immediately. So if you make changes in your 50s, you're offsetting your risk of stroke or cancer in your 70s, but it can be quite demotivating when you don't see change immediately, and that doesn't happen. You know, and again, if we think of the modern living, we reward ourselves with, you know, unhealthy things. You know, we might go for a meal, or we might go for drinks, or you know, we sit down and relax by watching television. The nice things that we do to reward ourselves for good behavior or success are not good for our health, unfortunately. And then I think it's important that we talk about the environment. So the Western world or modern living sets us up for failure. And we call this the obesogenic environment. So everything we do inhibits our ability to live healthily. And if you assess your environment, I think you'll agree with me. So things like, you know, most of us have a sedentary job. We sit all day. We might commute in terms of in our car or on public transport where we sit. Our physical environments aren't set up for us to be physically active in terms of safe places to exercise, you know, pathways, and, you know, safe roadways and so on. If we go into a supermarket, a lot of food is processed food. It's hard to buy good, healthy food. And the list is endless in terms of this obesogenic environment. So that can all impact on how we, you know, remove barriers in our daily life to actually making these lifestyle changes that we know are good for us. So hand over to you for a minute. Why don't you take a moment to reflect on whether you have a healthy lifestyle? So is your diet okay? Are you moderately physically active? Do you sleep okay? How stressed are you? And so on. Take a moment to think. And I mean, if I do that and I teach lifestyle medicine and I'm a practitioner, I would hand on heart say I don't have a healthy lifestyle on all of those pillars. And what gets in the way of that? Lots of things. It can be time, it can be money, it can be work, it can be family commitments, so caring commitments or child minding. It can be, you know, social support in terms of having a lack of social support. It can be mental health difficulties. It can be many, many things that are individual to each of us. And I think it's really important that you know your personal barriers before you start trying to implement any change. But let's talk about in general, got ahead of myself, what can we do to build sustainable habits? And from my own experience, I'm just presenting here things that have kind of tripped people up along the way. So people take on too much too soon. So always start small. And that could be taking on one thing at a time. And it can be quite small on paper, but it can be quite hard to implement. So for example, instead of changing your diet and saying, okay, I'm being plant-based from tomorrow onwards, try one healthy meal a day. Or try and walk the dog another loop around the block in the evening, rather than saying, okay, I'm going to be physically active now. Small, simple changes give you confidence and help you build up to more changes. And again, coming back to the environment and your personal, I suppose, psychological environment and physical environment, what are the barriers and facilitators of your chosen lifestyle? You need to know those upfront. And lastly, setting realistic goals. So many people set the bar way too high for themselves. And what happens when you don't meet a goal is you become demotivated, you lose confidence, you become a little bit, you know, oh, well, I tried, life is hard. So lower your expectations, lower your goals, and set realistic goals that you can carry on into the future. So again, in terms of strategies that can help you be successful, in RCSI, the head of the School of Medicine, Professor Suzanne McDonough, implements a lot of interventions for people with mental health conditions around walking. And one thing that's crucial to their plans or their interventions is building in an action coping plan. So you've probably heard of SMART goals, where you set out specific actions for what you're going to do. So an action coping plan takes it an extra level. So it's 6 questions to help you succeed and build in a plan to help you cope when things get difficult or when things become challenging or when problems arise. So the first 3 questions are based on SMART goals. What days will I do the chosen behavior? At what time? Where will I do it? With whom will I do it if with somebody else? So you're laying out exactly what you're doing. But then the next 3 questions are, what will I do if I'm too tired? Or if other barriers happen, like I have to work late and so on. Number 5 there, if something unexpected happens and I cannot complete my goal, I will what? So if you get sick or if you get an injury or if something happens that means you can't actually achieve your goal, what do you do? Do you reduce your goal? Do you, I suppose, restructure what you aim to do? Again, that's individual to you. And then the last question is, to help you remember, I will what? What will cue up this behavior for you? It could be lining up a friend or a family member to do the behavior with you. It could be leaving your trainers in the car. It could be anything that helps you to remember that you have set this goal for yourself. Another strategy, again, to help you incorporate new lifestyle behaviors is habit stacking. And this has become very popular in the mainstream now. It came from that book, Atomic Habits, if anybody has read that. It's a very good book. And what this is you take advantage of things you do well currently in terms of your health behaviors, and you add something to that. So you don't need to think about starting something new. You're queued up to do it when you actually do that existing habit. So for example, we hopefully all brush our teeth once or twice a day, and that's 2 minutes where you're at the sink. And that might be 2 minutes that you could do something else. So like doing 10 squats or lunges or stretching or taking 2 minutes to engage in deep breathing, whatever it might be. You know, in terms of our eating, you know, if you're having meat and 2 veg, why not add in a 3rd veg? So instead of potatoes and carrots, have potatoes, carrots, and parsnips. So again, you're stacking on to things you already do well. And again, that increases your motivation to do more. And lastly, before I hand over to Kate, behavior change does not occur without motivation and confidence. Your environment can be set up to support you, but if you're not motivated and confident, change won't happen. And if we think of these, you know, I often, when working with smokers, they're highly motivated to quit because they might have had a health scare, but they're very low in confidence because they have tried in the past, you know, have been unsuccessful, and they don't know where to start because they're addicted to nicotine. So again, change is very difficult there, and we need to incorporate professional support or medication. On the flip side to that, you can be very confident that you could change. For example, you can think, okay, I could get very fit very quickly because I used to be very fit, but I'm not very motivated right now. I'm too busy, I have too many commitments, and so on. So the last, I suppose, tip I would give to you is to ask yourself these 2 questions. On a scale of 1 to 10, how motivated are you to change your chosen behavior? And 1 being not motivated at all, and 10 being highly motivated. And then on a scale of 1 to 10, how confident are you that you can change the chosen behavior? So 1 being no confidence at all, 10 being highly confident. And in terms of the number you give yourself, there's no right or wrong answer. So the number you give yourself is information. So if it's 0, it's 0. And that's really important to know that. If it's 1 or 2, there's some motivation there, there's some confidence. What do you need to build that up? And again, it might be social support, it might be further information, it might be professional support, but identifying what you can do to increase your motivation and confidence is central to helping you make sustained change. So I will stop there and hand over to Kate, our lifestyle medicine physician, who is going to educate us on the pillars.
And just before you start, Kate, just to remind everybody that if you have any questions at all, feel free to put them into the Q&A, and we'll address them at the very end. But you can put them in as you come up, you know, as you think of questions. Thank you. I'll hand over to you now, Kate.
Perfect. Thanks so much, Tara. My name is Dr. Kate McCann. I'm a lifestyle medicine physician. So when patients get sent to me with chronic disease, that includes arthritis. So what I'm going to focus on are things that come up a lot in clinic with my real life patients. So I'm going to keep this short and sweet. So we're just talking about nutrition. I'm going to focus on three things. What do we need in our diet? What you probably don't need in your diet? And of course, what's always viral with the NutriBabble, what's the best quote unquote diet? Now, the best source of information for all of this is a registered dietitian, have a personalized. So I'm going to be talking about general. And then when it comes to nutrition, what should be in the diet? What we need are all the things we probably already know. We need fish, we need healthy fats, avocados, nuts, nut butters, olive and olive oil. We need pulses like lentils, chickpeas, beans. We need lots of fiber, colorful fruits and veg. What we need less of is sugar processed foods, processed meats. And what we probably also don't need in the diet are a lot of unnecessary supplements. So when it comes to supplements, there'll be supplements that may be prescribed by your GP, your rheumatologist, your orthopedic surgeon. That includes things like calcium, iron, vitamin D. Those are the ones that we need. And those are usually there because you need extra in your diet because you're chronic disease or you're not getting enough in your diet. What we definitely don't necessarily need is the over-the-counter supplements. And a lot of patients with arthritis and chronic disease get pressured into taking lots and lots of supplements, things like cayenne pepper and glucosamine and devil's claw. And we probably don't need those. There's not really good evidence that any of this really does anything for disease process. A lot of patients spend a lot of money on this. And when it comes to the best diet, and there's a lot of good information on the Arthritis Ireland website on this, it's the Mediterranean diet. And a Mediterranean diet that's high in protein, carbohydrate controlled, low in red meat, high in whole foods, not ultra processed foods. This is the one the evidence says patients are going to do best on. What we don't need is a highly restrictive diet. So there's a lot of trends about these myths that acidic foods or mushrooms or aubergines or certain types of potatoes will make arthritis worse. If you have questions about diet and arthritis, it's well worth asking either your rheumatologist, GP, to refer you on to a registered dietitian, which is the recognized qualification for giving personalized diet advice in arthritis. When it comes into exercise, and I'm going to use the word exercise as opposed to physical activity, because I want to talk about what we talk about intentional movement. What are we doing? Now, one of the biggest urban myths I hear from patients is that they shouldn't move with arthritis. And I think there's been a lot of work done to bust that urban myth, but just in case anyone out there still believes that you can't move with joint pain. We really should move with joint pain. Doesn't mean that all exercise is appropriate. Because when joints are painful or stiff, the thought of walking around a block is probably too much. But it is important that when we look at exercise, we're doing things like strengthening the muscles around the joints, maintaining bone strength, helps improve our energy, helps improve sleep, it helps improve balance and reduce falls, and also it helps improve mood. Exercises for arthritis can include exercises that put joints through a full range of motion. Exercise can increase the heart rate, and moderate intensity is fine. And that's really important because a lot of patients think when we talk about exercise, they have to be sweating, they have to be gasping, they have to be uncomfortable. You don't. Moderate intensity is fine. Moderate intensity, we can use the talk test. That means when you're going for a walk or you're doing aqua jogging in the pool, that you're at an intensity where you can still talk to the person next to you, but you're just putting in just enough effort that you would be able to sing them happy birthday. And that's a really good. It doesn't really matter what your Fitbit says. That's enough to be doing. We all need around 150 minutes of activity a week. That's a minimum. And that should be, especially for patients with chronic disease, that should be a little mix of strength and a mix of cardio. And something, especially for patients with joint disease, that's also looking after balance and flexibility. Certain activities like Pilates, for example, may tick more than one box. Pilates will look after a bit of your core strength, a bit of your flexibility, and a bit of your balance. you can keep the impact low. You don't need to be high impact. You don't need to be running if it hurts your knees. And again, for patients with joint disease, always move slowly to warm up. If you're having trouble returning to movement because of pain, it's worth talking to your doctor and get a referral into a chartered physiotherapist. That can be a great way to return to movement. For other patients who are having trouble getting back to movement, talking to your doctor about a referral to an X-Well program, there's one local to you, can be another great way to start. And if you are returning to movement after being sedentary for a long period of time, do listen to your body, start slowly, don't do too much. When it comes to exercises, I have patients say, well, what's the best exercise? The real best answer to that is the one you enjoy. If you don't like it, you're not going to do it. We want this to be something that is a habit you can build on. And if you don't enjoy the movement, you're not going to do it. It just becomes a source of stress. When we, sorry. And then 3 things to know about risk reduction. So alcohol, we do want to keep alcohol in low risk levels. This is incredibly important for patients who also have arthritis associated with gout. Most adults don't know what a low risk alcohol intake is. And if you're not sure, it's really worthwhile going on the Drink Aware website. They have a calculator. You can put in how much you're drinking, what you like to drink, and it'll give you an idea about what it should be. Because when we talk about things like, say, it should be less than 10 units a week, most people don't know what a unit is, and it really depends on what you're drinking. So it's worth keeping alcohol to a minimum amount, and definitely if you are going to consume alcohol within a low risk level. Smoking deserves special attention. We're talking about arthritis because there was a lot of misinformation that was circulated around 15 years ago saying that for certain types of arthritis, smoking might actually be preventative. There's absolutely no way anyone can say that smoking should be recommended for any health reasons. So smoking is not something we should be recommending to prevent or treat arthritis. It can actually make arthritis, certain types of arthritis, worse. It can increase musculoskeletal pain in a lot of different types of arthritis. It can also reduce effectiveness of certain types of arthritis treatments. So we want to avoid smoking. One of the things I now need to talk about when I talk about patients smoking is how do we quit smoking? If you're going to quit smoking, talk to your doctor, get support. Things that don't work to quit smoking include hypnotherapy. We definitely are not going to recommend that you take up a new habit like vaping. Quit.ie is an underused resource, but it's well worth checking out. This will link you in with both support and nicotine replacement. Nicotine replacement is safe to use in almost all cases where people have already been smoking. One of the things I'd like to highlight is other substances. Many patients feel that they need to take other substances, especially ones that contain CBD, as a treatment for arthritis. While there's been some clinical studies, there's no really good evidence that over-the-counter CBD has any role. One of the things would be is that if you are trying CBD and you think that's going to help and add into your treatment, that 1, you let your doctor know that you're taking over-the-counter supplements, and 2, that your normal pain team, whether that's your rheumatologist, your pain specialist, your orthopedic surgeon, whoever's managing your pain is still the person managing your pain. And don't let someone selling you CBD oil take control of your pain management. That's really important for a good and safe outcome. And lastly, I'd like to talk a little bit just about prehabilitation. So this is the route where most patients end up being sent to me. They see an orthopedic surgeon with severe knee pain or severe hip pain, and they're told that they need to do work before they're fit for surgery, or they recommend that they should get a little healthier and see if they can put off surgery a little bit longer. Prehabilitation is when we know that surgery is probably in a patient's future, or maybe in their future very soon, but it's elective surgery where we can put it off or wait a little bit, and we want to get the patient in the best physical condition for the best outcome. So prehabilitation is an excellent approach where we get our diet as healthy as possible, we get our movement where we have strong heart, strong lungs, strong muscles, where our mental health is in a good place and our sleep is good, and where our best physical health, that when we enter surgery, we have the best outcome with the fewest complications. And it's well worth engaging with your doctor, have this approach if you're anxious about accompanying surgery. And this is something that, again, special orthopedic surgeons might be discussing with patients. And lifestyle medicine plays a critical role in a prehabilitation approach. So I'm going to actually open things up to questions if Tara's happy. I'm going to give her back control here.
Thank you very much, Kate. So, great. Thank you so much, Kate and Lisa, for that really excellent overview. Really appreciate it. And I think we all have a better understanding now of what lifestyle medicine is and where we might start with it. So I think what we'll do is, as you say, we will open up now to some questions that we might have, and there's some coming in through the chat function there. And also just to remind people that we have Una Martin, advanced nurse practitioner, here with us as well. And Una will be able to answer any questions that are specific to arthritis itself as well. So there's actually a really good question here that came in, and it's from somebody who said that they're trying to stay alcohol free and they're aware of, the recommendations, but they're trying to stay alcohol free, but they're finding it difficult to be confident in that decision to remain alcohol free. I guess that's a lot to do with the society that we live in and things like that. So I don't know if maybe Kate, you might have some advice around that for people.
Yeah, so this would take a deeper dive, but when patients are unsure about giving up alcohol, there's some questions we ask, say, what is your trigger for drinking? When are you drinking? Is it with certain people? In that case, you're going to need to look at those situations of those people. Is it boredom? Do you have alcohol in the home? And it's kind of when you're watching TV at night. In that case, removing it from the home. So looking at when is it difficult for you? When's the trigger to drink? Is it a social thing? Is it by yourself? Is it a coping mechanism for any other reasons? And those are things that if you're having trouble exploring, your GP is a good place to start. But it's definitely something to explore why you don't feel confident in the decision.
Great, I think you're right. Thank you so much, Kate. Una, we have a question here from somebody about supplements, and I don't know, maybe you might be able to help us with that question. They're wondering if there's any specific supplements that might be beneficial for arthritis.
Yeah, I think it's just important, as Dr. McCann said earlier, to try and look at your diet first before going off to Holland and Barrett or a health food store to try and take some supplements, because the evidence isn't very strong. Just give a good all-round review of what you're eating. Maybe write a food diary for a week and see where you can make changes. And as a kind of resource, there's another very good webinar or podcast on Arthritis Ireland from a registered dietitian, which you could actually listen back to, and she gives us some very good advice about it. But like Dr. McCann said, things like your calcium and your vitamin D and your iron supplements that are prescribed, they're important. But other than that, really, you shouldn't really be buying anything over the counter because the evidence isn't very strong.
Okay, great. Thank you very much for that, Una. Yeah, I think there's a lot of information out there, and it's going to be hard to decipher what's accurate and what's not. Yeah. And yeah, actually, to point to that podcast and webinar that we did with Louise Reynolds around diet, that they're very helpful actually in terms of navigating that space. Lisa, I have a question here for you, and it's from somebody wondering, is there a particular pillar that they should address first? Should they look to one specifically before they start looking at the others? And is there any kind of, is there any best way to start with one of them, or should all 6 be addressed in combination?
Absolutely not. Don't start with all 6. Start with one. And I often think the one that might need to be started with is the one perhaps it's not recommended to you by a health professional at first. So oftentimes I take type 2 diabetes for an example, and people are told to focus on weight and nutrition, and that's fine. But if you really assess your life, it could be that you're not getting enough sleep, and that means that you are starting your day wrecked, and you might have a very stressful job on top of that. So you're eating foods for high energy. So understand what's driving the unhealthy behavior and what might need to be addressed in steps before that. So oftentimes things like sleep and stress can be, I suppose, setting up the other pillars to be poor, if that makes sense. So I really think addressing those first, but again, it's personal to that person. And also if they're, recommended that they need to overhaul different areas of their life, it might be good to also start with one that they think is the most manageable. And maybe that's their social connections. Maybe they feel that they actually need to garner a bit more support and share with people, or start engaging with more people in a positive way. And again, what I said, that builds up confidence and motivation to then maybe tackle one of the other ones, because these are life-standing behaviors that might have been with you for decades. And it's very hard to unpick that. So I think addressing the ones that might be underlying or driving some of the more common ones like physical activity and poor nutrition, but then also addressing what do you think is most manageable for you now, because it's about building confidence.
Yeah.
And just to come back to the alcohol question, I think Kate, everything she said is correct, but also to perhaps share with people, I'm cutting out alcohol for X reason. Because if you share that with people, they might kind of share with you back, oh yeah, that's actually a really good idea. But also if you're putting it out there, you're naming that. So therefore people might not pressure you as much. Because we do that. We say, oh, look, come on, have a drink. And that can be really hard to push back on that pressure. But I mean, sharing your reasons why is another way to help you stay firm when those social situations can be quite awkward.
Yeah, absolutely. Yeah. Great advice. Thank you, Lisa. We have another question here. I've had 2 hip replacements and have recently been diagnosed with arthritis in my feet. I love to walk and I do it daily. I walk through the pain, but I'm feeling okay. Am I right to keep going? Maybe, Kate, that might be a question you might want to answer.
So this is something, I don't know this person. I don't know their disease. In general, this is something you should be discussing with whoever your arthritis doctor is. Because when we're exercising through pain, it's not always bad, but we definitely should probably be getting expert advice that's right for us.
Yeah. I mean, it's no one size fits all approach really. And I think what you were saying earlier as well, it's about movement as well. It's whatever feels right. And if you're going through a flare, we always say not to stop completely, but you might need to tone it down, or just take it down a level so that it's not, you're not giving yourself additional pain that is difficult to deal with. Okay, let me see. We have lots of other questions here. Let's see. If there's a family history of arthritis, is it totally possible to avoid developing it? I think, Una, I would say that's probably a common question actually that we get, but I know that sometimes there can be family history and that there might be more of, I suppose, a predisposition towards it, but that's not necessarily always the case. And I suppose that's the role of lifestyle medicine really, isn't it? To try and prevent the onset of chronic conditions such as arthritis. I don't know if you have anything to add, Una, to that?
Yeah, I suppose when it comes to inflammatory arthritis, there is a strong genetic component to it. But it doesn't necessarily mean that if you have a family history of it, that you're necessarily going to develop it. But there can be clusters of other things in families, like somebody might have a bit of psoriasis, or somebody might have something like a colitis, and then they tend to cluster. But it doesn't matter. It doesn't really mean that you're going to automatically develop it. But the other things that are probably more important are the lifestyle things that can influence your arthritis overall. So, don't be sort of thinking just because my dad has it, I'm going to get it as well. It's not necessarily true, but it is something that we ask about when people come to clinic.
That makes sense. And just to mention to people as well that we run an extensive range of self-management programs at Arthritis Ireland. So our flagship program is Living Well with Arthritis, which is a program that we recommend people start with. And that's a 6-week program that helps people to address things like, for example, sleep issues, managing their diet and exercise as well, things like, dealing with medication and things like that. So that's our flagship program. But we also have other programs such as our adapted exercise program, which will help people if they're looking to increase their mobility. We have a Be Active with Arthritis program that's led by a chartered physiotherapist, and we have a Living Well with Pain program as well for people who are struggling with their pain. So there's a few people coming in and they're saying they're experiencing a lot of pain. So just to have a look at our self-management programs, and also to reach out to our helpline if you're looking for support. And the number for our helpline is 0818 252 846. And that it's manned by volunteers who know what it's like to live with arthritis, and they'll be able to provide you with support and possibly direct you to some of our other services as well if you are struggling with that. I'm just wondering here, so there's somebody here who said they're having trouble sleeping due to menopause, and they're wondering if there's any recommendations for them. I suppose we are going to address the sleep pillar on Thursday in that webinar, but I also think sleep is one of those ones where if you don't address sleep, it's very hard to address the other lifestyle pillars. I don't know if anyone would have any comments on that. It almost feels like it's the bedrock of everything, or the foundation for everything. So I don't know, Lisa, I know that's going to be addressed on Thursday and you're taking part in that webinar as well. So if people have specific questions about sleep, we might wait until then. But we also have a great podcast with Professor Annie Curtis, who talks about sleep as well. And she's from the RCSI, and that was recorded last year. So if anyone's looking for help with that, that might be a useful listen for them as well. I don't know if we have any more questions. I don't know if anybody has anything else they want to add to what we discussed today. Lisa, Kate, or Una, is there anything else maybe? Any other tips? I know, Una, that you were heavily involved in writing the booklet, Living with Your Best Life, a guide to living with arthritis. So
just going back to the lady who had problems with her feet and the walking, just two things. Maybe she could consider swimming as an alternative, as a form of exercise, and also maybe to look at her footwear. So that's really important. And again, there's a lovely new podcast on footwear from two podiatrists recently, and that's been really useful as well. So that's just another pointer for that person who had a query there.
Yeah,
and of course, don't forget our book,
yes,
which is available through Arthritis Ireland website as well, which will give you support. And again, at the beginning of the book, there's a lovely section which would be similar to what Dr. Mellon was talking about today, about how to get started with the goals and making goals that are meaningful for you. Because like we've all said, I think all three of us have said this morning, getting started is often the hardest bit, but making the goals that are meaningful for you is the most important bit.
And just to let everybody know, we have a lifestyle medicine section on our site, which has a link to a lot of our resources that we've just talked about, including the booklet that Una just mentioned. And that's under the Learn section of our website. And you'll find links to blogs that we write. Our health information officer, Maeve Coyle, writes so blogs about things like, for example, how to start with the Mediterranean diet, how to introduce a walking plan into your lifestyle. So there's lots of really helpful information in there and links to our podcast, and that's under the Learn section of our site. I have one more question that's come in, and I don't want to not address it because I think it's quite an interesting question. So it's from somebody who said that they have cut out all alcohol and sugar for 12 weeks and incorporated meditation activity into their daily activities every day. And they initially felt a boost for a few weeks, but then they went into a significant flare with additional symptoms. So have we any tips for motivating them to keep going when they're not seeing a tangible difference? I think that's a really, really interesting question. I don't know if anybody has any thoughts on that.
Well, I suppose I might pass across then to Una and Kate, but just a general thought that came to me there was, it might be helping you prevent other things, so you can develop other diseases as well. And what you're doing is so beneficial to your health for preventing all the other chronic diseases. So whilst it might not be tackling your arthritis right now, or a flare-up might be occurring in parallel with that, you are doing really good things for your overall health. And coming back to what I said, sometimes it's hard to be motivated because the benefits aren't immediate, but you're really offsetting further damage in later life. So it could be in the next decade and so on. So you're really helping yourself in a long-term fashion. I don't know if Kate and Una want to add more to that from an arthritis perspective.
Yeah, it's very hard when we talk about preventative health, is because you can't see what hasn't happened. So when you're looking after your health and things aren't happening, you never know what's not happening. And it is frustrating that when patients who have chronic disease take massive steps, make huge lifestyle changes, sometimes the effects on their health aren't what they hoped it would be for a number of reasons. Sometimes the disease process is just one that it will require more than just lifestyle interventions. But the benefits aren't always something we can see, and that is really, really difficult. And if you're struggling with it, this is one of those things where patient support groups can be important, working with your own GP can be important, talking to your rheumatologist or rheumatology nurse specialist can be important, to help keep that motivation there, even when you have flares or setbacks. And that applies to almost any chronic disease.
I would agree with both Kate and Lisa there. And I think also to like try not to be too hard on yourself and commend yourself. You've made quite a lot of significant changes. That's quite a lot of areas in your lifestyle that you've attacked or addressed from, I suppose, a lot of pillars at the one time. And maybe if you're struggling, maybe pull back a little bit and just maybe focus on 2 or 3 of the more meaningful ones too at this point, and then maybe go back and include one of the other ones at a later point in time. But like Dr. McCann and Dr. Mellon was saying, that they do take a little bit of time. And sometimes when you get a little bit, I suppose, stressed or demotivating yourself, that can cause a little increase in pain as well. So try not to, I always say to the patients, from every setback, there's always a comeback. So keep sticking with it for now.
I think good advice to end with. Thank you very much, everybody, for all of your contributions. And thank you to everybody for sending us in the questions and for participating today. I think we'll wrap up there. I just want to say thanks again to Dr. Lisa Mellon, Dr. Kate McCann, and Una Martin for joining us today, and everyone who joined in the webinar. We're looking forward to seeing as many of you as possible back on Thursday for the second webinar. And we're going to have great insights there around sleep, stress, and social connections. And also we have an online taster Tai Chi class with Kevin Copeland on Friday, which I hope you'll join us for. So thanks again to everybody. And this webinar has been recorded and will be uploaded to our YouTube channel. And everyone who registered will get a copy of the recording in a day or so. But feel free to contact us if you have any queries about the webinar for Thursday or Friday. And we look forward to seeing you all again soon. Thanks again. Thank you, everybody.